I'm Dr. James, and welcome to Pancreatic Cancer Warriors. If cancer runs in your family, you might wonder if you're at risk for pancreatic cancer. Today, we're going to explore the connection between family history and this challenging disease, and I'll help you understand what it means for you and your loved ones. Let's start by talking about how family history can increase the risk of pancreatic cancer. It's important to know that most cases of pancreatic cancer are not inherited, but having close relatives with the disease can raise your risk. This doesn't mean you'll definitely get pancreatic cancer, but it does mean you should be more aware and proactive about your health. When we look at family history, we're particularly interested in first-degree relatives. That's your parents, siblings, and children. If one of these close relatives has had pancreatic cancer, your risk is about doubled compared to someone with no family history. But remember, a doubled risk is still a relatively small increase in absolute terms. Now, let's dive a bit deeper into the genetic side of things. There are certain genetic mutations that can run in families and increase the risk of pancreatic cancer. You might have heard of some of these, like BRCA2, which is often associated with breast and ovarian cancer. But did you know it can also increase the risk of pancreatic cancer? BRCA2 is just one example. There's also PALB2, another gene that, when mutated, can raise your pancreatic cancer risk. And then there's Lynch syndrome, which is actually a collection of gene mutations that increase the risk of several types of cancer, including pancreatic. These genetic factors are important to understand, but they're not the whole story. Your doctor or a genetic counselor can help you determine if genetic testing might be appropriate for you based on your family history. Speaking of family history, there's an important distinction to make. Having one relative with pancreatic cancer is different from having multiple relatives with pancreatic or related cancers. If you have two or more close relatives who've had pancreatic cancer, your risk is significantly higher than someone with just one affected relative. It's not just pancreatic cancer in the family that matters either. Having relatives with certain other cancers, like breast, ovarian, or colorectal cancer, can also be relevant. This is because some genetic mutations that increase pancreatic cancer risk also raise the risk of these other cancers. Now, I want to stress something really important. Having a family history of pancreatic cancer doesn't guarantee that you'll get it. It's just one piece of the puzzle. Think of it as a heads up, a reason to be more vigilant about your health. It's about awareness, not fear. So, what should you do if you have a strong family history of pancreatic cancer? First, don't panic. Knowledge is power, and understanding your risk can help you take proactive steps. One of the most valuable things you can do is to consider genetic counseling. A genetic counselor can help you understand your family history in more detail and determine if genetic testing might be appropriate for you. Genetic counseling isn't just about getting a test. It's a chance to discuss your concerns, learn about your options, and make informed decisions about your health. If genetic testing is recommended and you choose to proceed, the results can provide valuable information about your risk and help guide your healthcare decisions. Regular checkups are also crucial for anyone with a strong family history of pancreatic cancer. Your doctor can help you develop a personalized screening plan based on your individual risk factors. This might include things like regular imaging tests or blood work to catch any potential issues early. It's also important to focus on lifestyle factors that can help reduce your risk. Maintaining a healthy weight, not smoking, limiting alcohol consumption, and eating a balanced diet rich in fruits and vegetables can all play a role in reducing your pancreatic cancer risk, regardless of your family history. Remember, family history is just one factor. It doesn't mean you will get pancreatic cancer. Many people with a family history of the disease never develop it themselves. And on the flip side, many people who do develop pancreatic cancer have no family history at all. What's most important is that you use this information to empower yourself. If you're concerned about your family history, talk to your doctor. They can help you understand your personal risk and develop a plan that's right for you. This might include more frequent screenings, lifestyle changes, or simply staying informed about the latest developments in pancreatic cancer prevention and treatment. Early detection is key when it comes to pancreatic cancer. By being aware of your family history and taking proactive steps, you're giving yourself the best possible chance at staying healthy. And if you do face a diagnosis, early detection can make a big difference in treatment options and outcomes. Don't underestimate the power of family support either. If you're worried about your pancreatic cancer risk due to family history, chances are your relatives are too. Talk to them, share information, and support each other in making healthy choices. Sometimes, facing these concerns as a family can make them feel less overwhelming. Lastly, I want to emphasize that medical advice is crucial when you're dealing with concerns about pancreatic cancer risk. While it's great to be informed, the internet can sometimes lead us down rabbit holes of worry. If you're concerned about your risk, make an appointment with your doctor. They can provide personalized advice based on your specific situation and family history. In conclusion, understanding your family history of pancreatic cancer is an important step in taking control of your health. It's not about living in fear, but about being informed and proactive. Remember, knowledge is power. By understanding your risk, staying vigilant with checkups, and making healthy lifestyle choices, you're doing everything you can to protect your health. Whether you have a family history of pancreatic cancer or not, the most important thing is to listen to your body, stay informed, and maintain open communication with your healthcare providers. Together, we can work towards earlier detection, better treatments, and ultimately, better outcomes for everyone affected by pancreatic cancer. Thank you for joining me today on Pancreatic Cancer Warriors. Remember, you're not alone in this journey. There's a whole community of warriors out there, patients, families, doctors, and researchers, all working together to fight pancreatic cancer. Stay strong, stay informed, and keep fighting. Until next time, this is Dr. James, wishing you the best of health.